Hi students, welcome to the class of Biochemistry. Myself Dr. Sureka, lecturer, Department of Biochemistry, SRM Dental College, Ramapuram. Today we're going to study the chief cation of the extracellular fluid and the intracellular fluid, that is the sodium and the potassium. So let us go into the lecture.
Sodium, it is a chief cation present exclusively in the extracellular fluid. About 50% of sodium will be present in the bone and 40% will be present in the extracellular fluid, and remaining 10 will be in the soft tissues. When we see the sources of sodium, the common salt used for the cooking purpose, that sodium chloride or the table salt, which is a major constituent of the sodium, which is a major constituent of the sodium which we regularly consume, and also the green leafy vegetables, milk, egg, bread, and also whole grains, the dry nuts can also have the enormous amount of sodium. These are all the various sources of sodium. The daily requirement of sodium for the normal individual is 5 to 10 gram per day. And if the patient is, if the person is having any hypertension history, so less than 5% is advised. And to the hypertension patient, only 1 gram per day of sodium is advised to consume. And when you come to the absorption of sodium, the sodium gets absorbed when we consume sodium as a form of table salt or from green leafy vegetables. So sodium gets absorbed in the gastrointestinal tract, and only 2% of less than 2% of sodium only gets excreted in the feces. But in case of diarrhea, large quantities of sodium will be released in the feces. When the sodium gets absorbed from the gastrointestinal tract, it gets entered into the blood circulation. So the plasma concentration of sodium was found to be 135 to 145 milliequivalents per liter. However, the blood cells do consist of less of sodium concentration, that is of 35 milliequivalents per liter. Since sodium is the extracellular cation, the blood cells do contain only the less amount of concentration. And also the mineralocorticoids secreted from the adrenal cortex influences the sodium metabolism. So thus blood cells do contain very less of your sodium in the cells. When you come to the excretion, the aldosterone secreted by the kidney, it controls the sodium excretion. So per day, 800 gram of sodium is filtered by the glomeruli. Out of 800 gram sodium per day, only 99%, only 1% gets excreted. The remaining 99% will be reabsorbed by the renal tubules, and some of the sodium will be excreted in the form of sweating from our body. When you come to biochemical function of sodium, sodium does major functions in our system. It associates with chloride and bicarbonate ions to form acid base balance. The sodium tend to control body's acid base balance, and also it tend to maintain the osmotic pressure and fluid balance. And sodium can also it is necessary for the normal muscle irritability and nerve transmission and cell permeability. These are all the various process or various mechanisms in the system where sodium is involved, and sodium is also involved in the intestinal absorption of glucose, galactose, amino acids, and it is also essential for maintaining the heartbeat. And now we have come to disease states of sodium, that is hyponatremia and hypernatremia. These two states of sodium is very important. It can be asked in your MCQs. Where we'll see hyponatremia first. Hyponatremia is a lowered level of sodium in the serum. This is possible during diarrhea, vomiting, chronic renal failure condition, and also during the impaired activity of adrenal cortex, that is adrenocortical insufficiency. It is sometimes called as Addison's disease. During this conditions, you can see reduced level of sodium in the serum, which leads to the condition called hyponatremia. The clinical manifestation includes reduced blood pressure and circulatory failure. And when you come to hypernatremia, hyper means increased level of sodium serum sodium level in the serum, and this may be due to the hyperactivity of adrenal cortex, the condition sometimes called as Cushing syndrome. During the syndrome there will be increased level of sodium is seen in the serum, and also the prolonged administration of cortisone, ACH, TH, and also sex hormone can also increases the level of sodium in the serum. The clinical manifestation of hypernatremia includes edema. And with that, our sodium gets over. In sodium, we have seen what is sodium and what all its sources, and dietary requirement, absorption, plasma concentration, excretion, and biochemical importance, and its disease states. Now we'll see the same in potassium. The potassium is the intracellular cation, whereas your sodium is the extracellular cation. Here, the potassium is the intracellular cation. It also does various special function in our system. And when you come to the sources of potassium, it is majorly present in the tender coconut, and also it is present in oranges, pineapple, banana, beans, and also in meat, chicken meat, and also in your potatoes. These are all the various sources which consist of potassium in it. Requirement of potassium is about 3 to 4 gram per day. Each day we need to consume 3 to 4 gram. And when you come to absorption, 90% of potassium gets absorbed in the gastrointestinal tract. Very, very little will be eliminated in feces. But during the diarrhea condition, there will be a large quantity of potassium will get eliminated in the feces. When you come to plasma potassium, the absorbed potassium from the gastrointestinal tract gets enters into the blood circulation, and the plasma concentration of potassium was found to be 3.4 to 5.0 milliequivalents per liter. And also your potassium is a intracellular cation. It tend to accumulate inside the blood cells. So the blood cells will be consisting more of your potassium, that is 50 milliequivalents per liter, than the plasma. And when you come to the excretion, the potassium is mainly excreted in the urine, and in order to maintain the acid base balance, the more of your potassium gets excreted in the urine, and the excretion is triggered by the aldosterone. When you come to the biochemical function of potassium mainly involved in the maintenance of osmotic pressure, and it also tend to regulate the acid-base balance, water balance in the cells, and it is also act as a cofactor for the pyruvate kinase enzyme, and it also required for the transmission of nerve impulse, and it is also necessary for the synthesis of proteins by the ribosomes, and it also influences the cardiac muscle activity. These are all the various function where your potassium gets involved. And when you come to the disease states of potassium, here also we have hypokalemia, hyperkalemia. There in sodium we have seen hyponatremia and hypernatremia. In case of potassium, it is called hypokalemia and hyperkalemia. This is two disease states where potassium level is lowered or increased. And this is also this topics can also be asked in your MCQs. So we'll see what is hypokalemia, which is a lowered potassium level in the serum. This condition may be due to hyperactivity of adrenal cortex during Cushing's disease, or prolonged administration of cortisone, or intravenous administration of potassium fluid, prolonged diarrhea, and vomiting. These are all the various conditions which influences the uh, lowered level of potassium in the serum. And the clinical manifestation includes irritability, muscular weakness, tachycardia, cardiomegaly, and cardiac arrest. When you come to hyperkalemia, there will be increased potassium level in the serum, and this may be due to chronic renal failure and adrenocortical insufficiency disease, such as Addison's disease, diabetic coma, severe dehydration, and when you administer excess of potassium salts intravenously, can also leads to increased level of potassium in the serum. And the clinical manifestation of hyperkalemia includes depression of central nervous system, mental confusion, numbness, bradycardia, and cardiac arrest. So, these two disease symptoms are mainly involved in the potassium abnormality. That is, when you have a lowered level of potassium, it can lead to hyperkalemia. When you have higher level of potassium in the serum, it can lead to hyperkalemia. These are all the various disease status involved in the potassium. So far we have seen the sodium and potassium, its sources, its dietary requirement, and its plasma absorption, excretion, and biochemical function, and its disease status.
Thank you, students. Hope the lecture would be useful. For further clarification, please do comment. Thank you.